Healthy living is top of mind these days. When it comes to diet, nutrition, and fitness, there's really no shortage of resources. So why is it we seldom consider what is arguably the most important part of overall wellness, our mental health? Listen to this. 1 in 5 adults experience some form of mental health disorder throughout their lifetime. Of those afflicted, more than half fail to seek assistance. Here to help us understand why is Dr. Peter Ventre from Ventre Medical. Welcome, doctor.
Glad to be here.
Oh, I'm so happy you're here because I think this is really an important topic. First, let's talk about what is mental health and why it's important to understand it.
So mental health is our daily living. How do you think about things, how you worry about things, how you interact with people, how you work, how do you concentrate, how you sleep.
Truly, it affects even your entire life, your work, your space, friendships, love, I mean, everything. What are some signs and symptoms of mental health disorders, doctor?
Mental health is something that impair your life. Symptoms that we can look for, lack of sleep, lack of appetite, depression, sadness, feeling overwhelmed, concerns about concentration at work. They feel aloof. They don't feel they're adequate to interact with other people.
And are these conditions, disorders linked to something? And is it something you see a lot in your practice?
And all is a multifactorial. We have the genetic component, we have the environmental component.
Nature versus nurture.
Absolutely, absolutely. If you know that your father was an alcoholic or is an alcoholic, be careful. You have to tweak a little bit the drinking behavior because you can end it in the same way. And then we have the interaction of everyday traumas, a bad divorce or a loss of a loved one. And now you have to encounter the daily activities is more difficult for you because of these traumas.
And are these conditions linked to something, doctor? And I'm imagining this is what you see in your practice daily.
Every symptomatology might be attached or correlate with a specific disorder. Can be bipolar, can be depression, can be schizophrenia, can be ADHD, can be anxiety.
So at Ventre Medical, if someone comes in, what is the first step in how you identify and assess the patient and diagnose them?
The first thing is to see if there's no medical or organic cause. We need to do a CAT scan, blood work, MRIs to see what is going on. Number 2, we want to be sure what's your history. We have to be 100% sure that you have depression, no other comorbidities like OCD or bipolarity. So I always like to do a very thorough psychological and psychiatric examination before we pull the trigger and pick the right diagnosis.
Let's say you're diagnosed, you've assessed the patient. What is the treatment options there?
We have a variety of treatments. We have doctors board certified, we have therapists, we have nurses, we have a research institute as well. We are extremely versatile, and that is always a treatment option.
Do you use medications, or is it kind of like you have to evaluate the patient first to figure out what they need?
I'm extremely careful with the medications. So if you have a common cold, you come to me and I prescribe you right away antibiotics. That is not the right way. So I have to listen to you. Probably you need to talk to someone. You need therapy. You need more exercise. You need to eat a little bit better. You need to change lifestyle. And then if that doesn't do it for you, then we have to look a little bit deeper into the problem and maybe go to the traditional medication.
And what are the alternative treatments for patients?
Like any other areas of medicine, we have evolved so much. There's certain treatments right now in scientific base that can substitute or be a very good alternative for medication. For example,
as?
TMS, transcranial magnetic stimulation.
What is that?
TMS is a new magnet, and that magnetic impulse basically activates your brain cells and tells the brain cells, let's start producing all those chemicals that you were lacking for many, many years.
Like the serotonin and norepinephrine?
And everything, yes.
So they feel happier, they feel better. What do you see after they've gotten the treatment?
I have seen patients who have failed every single therapy, every single cocktail, combination of medication, coming to TMS, and in less than 10 treatments, they're smiling, they're doing better. That's completely painless and is extremely
FDA
safe.
regulated?
It's FDA approved.
I know you have a passion for this. You've been doing this for a long time. It must make you feel so rewarded.
When you make that life better, you make other people's life better. It's like a domino effect. If you're doing well, your family's doing well, your coworkers doing well. So that is very important for me.
For a viewer out there who maybe has been wanting to get help, who's thinking of maybe going to Ventre Medical, but just doesn't have the courage, what would you say, doctor? Just
call our office. We're extremely open-minded. We are completely confidential. Don't let that drag you down. You're one phone call away to feel much better.
That's right. For our viewers who'd like more information, where do they go? What's the website, doctor?
They can go to ventremedical.com. And like I said, it's all about continuity of care. Know that you can change, that this doesn't have to stick with you forever, and we have the solution. Everything in life has solution.
Absolutely. Life is certainly worth it.
Thank you,
Thank
Olga.
you so much, doctor. God bless you for what you do. And if you'd like more information on Ventre Medical, you could also check out our website, and that's thebalancingAct.com.